27.72% of Australians aged over 18 have had their booster. 236,338 had them yesterday. 95% and more of Australians over the age of 16 have had their first dose. 92.7% have had their second dose. That's what's been happening over the summer. Workforce has been a particular challenge, and the Treasurer will speak more to this. But workforce was a challenge before the pandemic, and the government was already taking actions in that area, as we had been over some years, particularly in the area of skills and training, which I'll reflect on in just a moment. But particularly to deal with the challenges of disruption in the workplace. Same challenge you've seen with the health workforce, aged workforce in countries all around the world. They have these problems in Ottawa like they have them in New South Wales. They have these problems over in the UK just like we have them here, or in France, or in Spain, or in Germany, or in any of these places. They have the same problems that we're dealing with here, with disruption to workforces. Close contact rules were changed for essential workforces, and that definition of essential workforces was expanded. The Treasurer can tell you that in the work on supply chain management, that those changes are having an impact, and we are seeing some of those shortages alleviated, particularly in the poultry sector, which is, I've spent a lot of time on the poultry sector in the last week, and we're getting those poultry sections, that poultry sector back on a good footing. But things were pretty tight there for a week or two, in particular. And I want to thank all those leaders in the poultry sector that have worked closely with us to troubleshoot and fix some of the immediate problems they had, which can ensure that we could maintain continuity of those food supplies. Everyone at the National Coordinating Mechanism, Joe Buffoni in particular, Karen Andrews previously, and of course the Treasurer most recently after his return from having COVID himself. Private hospital agreement that we put in place at the start of the pandemic, that is now delivering 100,000 extra healthcare staff, including 57,000 nurses, to support our public hospital system and aged care. That's what preparation is. We put that in place in 2020, and we have drawn on it consistently to be able to draw more workforce in. Now, there aren't magic workforces that can just turn up and provide the sort of care that you need in healthcare. You need to have people who are trained. And that is true also in aged care. There is not some shadow workforce that sits in the Defence Forces or somewhere else that can automatically just replace furloughed staff because they have COVID. And so that does mean there are shortages. And you have to make changes, and I want to thank all those working in the hospital system who've been making those to ensure that they can continue not only to support patients who have COVID, but also patients who need necessary treatment in our hospitals. We've revised the ADF civilian assistance protocol for the Defence Forces and Australian Public Service support. In November, we had started to scale that down. That was pre-Omicron because of the situation we're in, and there was not the need for that ADF support that had previously been needed in earlier waves. That has been revised over the course of Omicron, and the proof of that is there are some 20 ADF drivers who will be in Victoria supporting their paramedics, and there is additional staff and planners who are going down to support that task in response to the request made by the Premier to me, and also O call support centre staff coming out of the Australian Public Service. We don't always meet every single request from the ADF. Sometimes we can meet it from Australian Public Service personnel, and we make them available. So O call centre is a good example. Contact tracing is another one. The Commonwealth is seeking to support where we can with the people that we have. On skills and training, $6.4 billion this year alone is being spent on skills and training. That is double what it was before the pandemic. We have doubled skills and training investments by the government today compared to before the pandemic. One of the first things the Treasurer and I did in the pandemic was ensure that we held on to those apprentices. Even before JobKeeper, the decision we made to give wage subsidies to keep apprentices in their jobs ensured that those apprentices who would have lost their jobs in the early days of their pandemic are now 2 years further on in their training and are working in our economy. and keeping our economy functioning. They were the most vulnerable workers in the entire labour force, and we moved on keeping them in their apprentices as a top priority as part of our initial economic response. And today, we have a record number of apprentices in trade training, over 220,000. That is the highest number since records began in 1963.